Hey, it's Dr. Mandell, and before you turn off the light tonight, I want you to ask yourself something. When you climb into bed at the end of the day, do your feet feel cold, maybe a little numb, or that strange tingly feeling like pins and needles, especially in your toes? If you answered yes to any of those, I want you to know something important. That is not normal aging. That is your body sending you a signal. And tonight, I'm going to help you answer it. Because in the next few minutes, I'm going to walk you through a simple 5-minute routine. 5 gentle movements you can do right in your bed, right before you go to sleep, that can genuinely restore blood flow to your feet. Not tomorrow, not after weeks of hard work. You may feel the difference tonight. I've been working with patients for over 40 years, and I'm telling you, this is one of the most powerful, most overlooked things you can do for your health after 60. So stay with me. Let's do this together. Now, before we get into the routine, I want to take just a minute or two to help you understand why this is happening. Because once you understand the why, you're going to take this much more seriously, and you should. Here's how your circulation works in plain English. Your heart pumps blood down to your legs and feet. That part is easy. Gravity helps. But getting that blood back up to your heart, that's the hard part. And that job falls largely on the muscles in your calves and legs. Every time those muscles contract, every time you walk, move, flex, they squeeze the veins and push blood upward. Your veins have tiny one-way valves that keep that blood moving in the right direction. Now here's what changes after 60. Those calf muscles get weaker if we're not regularly using them. The walls of the blood vessels lose some of their elasticity. They don't respond as quickly. And those venous valves, they become less efficient over time, which means blood starts to pool, to collect in the lower legs and feet instead of moving freely back to the heart. And it gets worse. Most of us are sitting far more than we should be. Hours in front of the television, at the computer, in the car. Every hour you spend sitting without moving, blood is slowly pooling in your lower extremities. Add in tight socks, shoes that don't fit well, and the fact that most older adults are mildly dehydrated on a daily basis because the sense of thirst actually decreases with age, and you've got the perfect recipe for poor circulation. And for people dealing with elevated blood sugar or diabetes, even mild, undiagnosed cases, there's an additional layer. High glucose gradually damages the tiny blood vessels and nerves that supply the feet. That's why foot complications are so common in diabetic patients. So what does all this feel like? Let me ask you, do your feet feel cold when you get into bed, even when the rest of your body is warm? Do you get that pins and needles sensation, especially in your toes? Do your ankles look a little puffy by the end of the day? Do you wake up in the middle of the night with a leg cramp that stops you cold? And have you noticed that small cuts or scrapes on your feet seem to take longer to heal than they used to? If any of those sound familiar, you are not alone. Millions of Americans over 60 are dealing with exactly this. And the most important thing I want you to hear right now is this. You do not have to just live with it. Now, you might be wondering, why do this at bedtime? Why not in the morning or during the day? Great question, and the answer has everything to do with how your body works. First, when you lie down, you take gravity out of the equation. All day long, gravity has been pulling blood down into your legs and feet. The moment you lie flat, your body gets a chance to redistribute that blood more evenly. Your heart doesn't have to work as hard. And the blood that's been sitting in your lower legs, it now has a much easier path back to your heart. Second, your body does its most intensive repair and recovery work while you sleep. Growth hormone is released, inflammation is reduced, tissue gets rebuilt. If you do this routine right before sleep, you're essentially priming your circulatory system, giving your body the best possible conditions to do what it does naturally: heal. Third, and this is something I tell all my patients, doing this routine at the same time every night turns it into a habit. Your brain starts to associate these movements with the transition to sleep. And what does that mean? It actually helps you fall asleep faster and sleep more deeply. A lot of people tell me their nighttime leg cramps nearly disappear within the first week just from doing this consistently. Your body does its best repair work while you sleep. Let's give it the right conditions to do just that. All right, let's get into it. This is the part you've been waiting for. You can do all of these movements either lying flat in bed or sitting on the edge of your mattress, whatever feels most comfortable for you. You don't need any equipment. You don't need to change clothes. All you need is 5 minutes and a little bit of intention. Ready? Let's go. Step 1. Ankle pumps. 1 minute. We're starting with the most important movement of the whole routine: ankle pumps. Here's what you do. Lying flat on your back, keep your legs straight. Now flex your feet, pull your toes up toward your shins as far as they'll comfortably go. Hold that for just a second. Then point your toes down, away from you, as far as you comfortably can. And repeat. Up and down. Up and down. Think of it like pumping a gas pedal, nice and steady, nice and rhythmic. Aim for about 20 to 30 repetitions, or just do it continuously for a full minute. Now, why does this work so well? Your calf muscles, the gastrocnemius and soleus, are essentially a second pump for your circulatory system. Every time you flex that foot, those calf muscles contract and squeeze the deep veins, pushing blood up toward your heart. Vascular physiologists actually call this the peripheral muscle pump, and for people with reduced cardiovascular function, it can make a dramatic difference. You'll probably feel a warmth or a gentle pulsing sensation in your lower legs as you do this. That's exactly what you want. That's your circulation waking up. So ankle pumps, 1 full minute. Let's move. Step 2. Toe circles and toe spreads. Now we're going to bring the attention all the way to the tips of your toes, because that's the area farthest from your heart, and often the first place where circulation becomes compromised. Part 1. Toe circles. Starting with your right foot, slowly rotate your toes in a wide circle, clockwise for about 5 rotations, then counterclockwise. Repeat on the left. Part 2. Toe spreads. Now try to spread your toes apart as wide as you possibly can. Hold that spread for 3 full seconds. Then relax and let them come together naturally. Repeat this 5 to 6 times on each foot. I know this sounds almost too simple, but here's the science. The smallest blood vessels in your body, your capillaries, are concentrated most densely in the tips of your fingers and toes. These tiny movements stimulate blood flow into those capillary beds in ways that larger movements simply can't reach. And for people with diabetic peripheral neuropathy, that numbness and tingling that tends to start in the toes, This kind of gentle, targeted stimulation is genuinely therapeutic. You may find that your toes don't want to spread much at first. That's completely normal. With consistency, you'll see real improvement in mobility and sensation within a few weeks. Step 3. Leg raises and heel slides. 1 minute. This next step combines two movements that work together beautifully. We're going to activate the larger muscle groups of the thigh, the quadriceps, to drive circulation through the entire lower limb. Leg raises first. Lying on your back, keep one leg flat. Slowly lift the other leg, keeping the knee straight, up to about a 45-degree angle. Hold it there for a count of 5. Then slowly lower it back down. Alternate legs. Aim for 6 to 8 repetitions per side. As you hold that leg up, you're creating a mild muscular contraction throughout the thigh and calf that drives venous blood back toward the core of the body. Now, heel slides. While still lying flat, bend one knee and slowly slide your heel toward your bottom, as far as is comfortable. Then slowly slide it back out until the leg is straight again. This engages the hamstrings and hip flexors and gently mobilizes the knee joint, which also has a rich network of blood vessels. Now, I want to say something important here. If you have hip replacement, knee issues, or significant arthritis, skip the leg raises and just do the heel slides. The heel slides alone are excellent. Never push through pain. Always work within your own comfortable range of motion. Step 4. Calf self-massage, 1 minute. For this step, I'm going to ask you to sit up on the edge of your bed, or if sitting up is difficult, you can prop yourself up against your headboard with your knees slightly bent. We're going to use our own hands to do what blood vessels can't always do on their own. Manually move the blood. Take both thumbs and place them side by side at your ankle, just above the heel. Now apply firm but comfortable pressure and slowly drag your thumbs up the back of the calf, up toward the back of the knee. Slow, steady, deliberate. When you get to the top, lift your hands, return to the ankle, and repeat. Work your way up the full length of the calf 3 or 4 times. Now, pay attention. If you find a spot that feels tender or particularly tight, spend a little extra time there. Work in small circles. That tenderness is a sign that blood has been pooling in that area. The pressure you're applying is physically displacing that pooled blood and encouraging fresh, oxygenated blood to take its place. This kind of mechanical compression has been used in clinical settings for years. It's essentially what compression therapy and pneumatic leg devices do for patients recovering from surgery or managing venous insufficiency. You're doing a simplified version with your own hands, right in your bed. One important note: if you notice that one leg is significantly more swollen than the other, or if one calf is red, warm to the touch, or painful with pressure, please do not massage it. That can be a sign of deep vein thrombosis, and I'll talk more about that in just a moment. In that case, please call your doctor. Step 5. Elevated feet plus diaphragmatic breathing, 1 minute, 15 seconds. This is my personal favorite step, and I think it might become yours too. Lie back down and grab your pillow or fold a blanket and place it under your feet and calves so that your legs are elevated about 6 inches above the level of your heart. If you have a second pillow, use it. You want enough height that gravity is actively pulling blood away from your feet and back toward your torso. Now, in this position, we're going to do diaphragmatic breathing, deep belly breathing. Place one hand on your chest and one hand on your belly. Take a slow, deep breath in through your nose for a count of 4. As you inhale, feel your belly rise. Your chest should stay relatively still. Now exhale slowly through your mouth for a count of 6. Let your belly fall. In, 2, 3, 4. Out, 2, 3, 4, 5, 6. Do this for a full minute or more. Here's what's happening. Deep diaphragmatic breathing creates a pressure change inside your chest cavity, a negative pressure that literally pulls blood from the peripheral veins back toward the heart and lungs. It's one of the most efficient ways to enhance venous return without any strenuous exercise. At the same time, elevating your feet allows gravity to assist in draining the blood that's been pooling in your lower legs all day. And here's the bonus. This combination, slow exhalation, leg elevation, quiet darkness, activates your parasympathetic nervous system. Your heart rate slows, your muscles release tension, your body shifts from the stress response into the recovery response. In other words, this last step doesn't just improve your circulation, it prepares you for the deepest, most restorative sleep you've had in a long time. You'll feel the difference within 60 seconds. I guarantee it. Now let's talk about what you can actually expect, because I want you to be realistic, but I also want you to know how powerful this truly is. In the first week, most people notice that their feet feel noticeably warmer when they get into bed. That cold, heavy feeling starts to lift. A lot of people also report fewer nighttime leg cramps. Sometimes they disappear almost entirely. And sleep quality improves. People are falling asleep faster and waking up less often through the night. By the end of the first month, the results become more visible. Ankle swelling, that puffiness you see at the end of a long day, tends to reduce significantly. The tingling and numbness in the toes becomes less frequent or less intense. And people notice something they hadn't expected. Their first steps in the morning feel lighter. That stiff, heavy feeling when you first get out of bed, it starts to ease. At 3 to 6 months of doing this consistently, something deeper is happening. The calf muscles themselves are getting stronger because you're using them every day. The venous system is becoming more efficient. Some people with mild peripheral neuropathy report meaningful improvement in sensation. And the risk of one of the most serious complications of poor lower limb circulation, deep vein thrombosis, or DVT, is meaningfully reduced. 5 minutes a night, every night, that's all this takes. Your feet carry you through every single day, through every errand, every walk, every moment of your life. It is time to give them something back. Now, I would not be doing my job if I didn't take a moment to talk about this. This routine is powerful. I believe in it. But it is not a substitute for proper medical evaluation. There are specific signs and symptoms that mean you need to pick up the phone and call your doctor, not just try a new stretch. Please contact your healthcare provider if you notice that one leg is significantly more swollen than the other, especially if it came on suddenly. This can be a sign of deep vein thrombosis, and it requires immediate attention. You have a wound, sore, or ulcer on your foot that isn't healing, or that seems to be getting worse. In people with diabetes or significant arterial disease, this can progress rapidly. You experience severe pain, sudden color changes in the skin, purple, blue, or dead white, or a limb that becomes cold and pulseless. These are vascular emergencies. You have already been diagnosed with peripheral artery disease, diabetes with complications, or a clotting disorder. In those cases, please talk with your physician before adding any new routine, even a gentle one. This routine is designed for people with general age-related circulatory slowing. It is not designed to treat vascular disease. When in doubt, get checked. Your doctor is your partner in this. All right, let's bring it all home. Tonight, before you turn off the light, I want you to do 5 things. 1. Ankle pumps for 1 minute. 2. Toe circles and spreads for 45 seconds. 3. Leg raises and heel slides for 1 minute. 4. Calf self-massage for 1 minute. And 5. Feet elevated, deep breathing for 1 minute and 15 seconds. 5 minutes. That's it. And if this video helped you today, I have one small favor to ask. Share it with someone you love. Your spouse, your sibling, your best friend, your neighbor. Someone whose feet deserve a little more attention. Because at Healthy Aging America, that's what we're about. Giving you the real, practical tools to live better, feel better, and age powerfully. If you found value here, please hit that like button. It helps more people find this video. Subscribe so you never miss a new video. And leave me a comment right now and tell me, which step did you feel the most? I read every single one. I'm Dr. Alan Mandell. Take care of those feet. Good night, and I'll see you in the next one.